This step-by-step video will walk you through the process of administering your compounded medication safely and effectively. Let's get started. Now that your medication has arrived, the first step is to ensure all components are accounted for before you dispose of any packaging. Your package should include the following: alcohol swabs, a pack of empty injection syringes, and your vial of compounded medication. Syringes will not be pre-filled with medication. Do not dispose of the cold pack until you locate the vial of medication, as it may be tucked away in the same pouch. Start by washing your hands. If your medication is in the refrigerator, this is a good time to take it out so that it can warm to room temperature before being administered. Next, remove the metal cap from the medication vial. Using an alcohol swab provided, wipe down the top of the medication vial, where you will be inserting the syringe, to clean and sterilize it. Next, sterilize the injection area by wiping it with a new alcohol swab. This medication is typically injected into the subcutaneous tissue, which is the fatty layer just beneath the skin. The most common injection sites are the abdomen, outer thigh, and back of the upper arm. Rotating the injection site is important for promoting comfort during injections. It's now time to draw your medication. Start by removing the caps from the syringe and plunger. Pull the plunger back, drawing air into the syringe. Next, insert the needle into the vial of medication through the rubber cap. Inject the air from the syringe into the vial. Make sure the tip of the needle is fully submerged in the medication as you pull the plunger back to the correct number of units. This will help prevent air bubbles. Air bubbles aren't harmful, but they could take up room in the syringe, preventing you from receiving the correct dose. Your care team will have determined your appropriate dosage and which syringe size you should use. If you see you've been prescribed 0.1 milliliters on the medication vial, this will equate to 10 units on the syringe. Similarly, 0.2 milliliters will equate to 20 units, 0.3 to 30 units, and so on. Keep in mind that you will never inject the entire vial of medication at one time. You're now ready to inject the medication. Gently pinch a fold of skin around the injection site to create a small raised area. Hold the syringe at a 90-degree angle to the skin fold. Quickly and steadily insert the needle into the pinched skin fold, making sure the needle goes all the way in. Slowly push down on the plunger until your full dose of medication is delivered. Hold for 5 seconds. Once the medication is completely delivered, carefully withdraw the needle. Dispose of the used needle and syringe according to your state's specific disposal requirements, which can be found at safeneedledisposal.org. Used needles should never be thrown loosely into the trash or toilet. Place the remainder of your medication in the refrigerator until it's time for your next dose. And that's it. If you have any questions about how to administer your compounded medication or your correct dosage, don't hesitate to reach out to your LifeMD care team.